the current prevention control situation of COVID-19 in the city of Guangzhou. First of all, basic situation. As of 24 o'clock of February the 16th, we have nearly 1 death and 14 discharged. And cumulatively, we have reported 983 cases and 206 discharged and 15 deaths. Currently, still in hospital, 762, among which 74 severe cases and 25 critical cases. With the control measures being implemented currently in the city of Guangzhou, the development of the epidemic have seen some periodical trends: 2 reduction, 2 stability, and 2 rises. 2 reduction refers to the reduction of newly confirmed cases. Our daily record is 104 confirmed cases and has been reduced for 5 consecutive days and right now to about 30 on a daily basis. And yesterday our confirmed cases was 8, and today we also realize another reduction. And second is the reduction in the number of patients. Our peak is 1,500, and right now it's 500 on a daily basis. The 2 stabilities refer to: first is the stabilization of newly increased suspected cases. For 5 consecutive days, newly suspected cases amounts to 20. And second is the medical observation. And on a daily basis, the number amounts to about 650. And second rise, then third is 2 rises. First is the rise of recovery rate. Second is the rise of critical and severe cases. Right now, this number amounts to about 12%. Currently, the prevention control of NCP in our city still is at a very critical stage. We are faced with a daunting task ahead of us. We have to strengthen our confidence, take more decisive measures to win this battle against COVID-19. Second aspect of my introduction is prevention control measures. Since the outbreak, we have acted according to the important remarks and instructions by General Secretary Xi Jinping, as well as the guidelines issued by the central government and provincial government and party commission. We have given priority to people's health and life and safety, and prioritize prevention and control and make it the central task of our city government. And we have identified the key tasks. First of all, to establish an accountability system at different levels. The government at each level is accountable for the situation of their own jurisdiction. We have formed a special working team that is a transformation of the previous specialized working team. The party members are working at grassroots levels to arrange the prevention control measures at the community level. And second is to conduct our work more specifically, in a more specific way, to the units or even households of living quarters. We also have conducted this kind of listed working mechanism and make sure of the implementation of such accountability measures. The second is to conduct strict screening and testing. And we need to make sure that no household is left unchecked. We conduct this overall comprehensive body temperature checks of all the population, establish and have renovated 5,630 rooms right now. We still have more than 1,000 people who are in the isolation quarantine point, and many more are staying home for quarantine. And second is to admit all of those that could be admitted. And right now we still have 694 patients who are experiencing fever with no clear cause, and they are all kept at the clinic at the outpatient for observation. 3. Strengthen joint prevention and control. We have closed the entrances of the living quarters of the communities and leave only one entrance for each living quarters. And we have arranged personnel to stay on call 24/7. There are some places with cumulative incidents. These are our key areas. We have also set up checkpoint to arrange person to do checking 24/7. We have also prioritized our measures in terms of the prevention and control in the public places, entertainment facilities, as well as supermarkets and commercial halls with confirmed cases to prevent cross-infection. Fourth is to conduct a scientific prevention, control, and treatment diagnosis. We have accumulated the best medical resources to strengthen treatment of the severe and critical cases to improve recovery rate and reduce fatality rate. We also attach importance to the treatment of light syndromes, use integrated medicine methods to improve the treatment technologies so as to prevent the light syndrome cases from turning into severe cases. We also have categorized the patients according to their situation and syndromes in order to make the best use of the medical resources that is available to us. Hereby, please allow me to thank all of the medical workers who are working at the front line non-stop, especially those who came to our aid from Jiangsu Province. They are the most beautiful fighters and soldiers in this epidemic, in fighting of this epidemic. Fifth, ensure the supply of medical resources with procurement and donation, as well as support from the upper government. We have allocated 33,000 masks, 3 million medical masks, 56,000 goggles, and we have reached a very tight balance. In terms of daily necessities, we have meat reservation that is enough to sustain a week, and also enough vegetables, and we conducted this online ordering and distribution, delivery of these daily necessities. We also have strengthened more practices such as illegal hoarding or price elevation. We also set up hotlines, mayor's hotlines, and platforms to answer to the calls and needs of the public and answer to the concerns, to the public concerns. The Provincial Commission have just issued a document concerning the guidelines to fight the battle against COVID-19. And we also have made comparisons and find some of the challenges ahead of us. First is that we have experienced some change in terms of the epidemic. At an early stage, the most cases are imported cases. Right now, they are expanding in the city, in between families and communities. So the path of transmission is still unclear. There are some cases that do not have a very clear syndrome that might make it a substantial danger. We also have a lot of enterprises in our city, so it is even more challenging for us to prevent the disease from spreading. Second, we also are facing some more uncertainties. Right now, a lot of people are back to work, and the workers, as well as the farmers. This is an important juncture for us because we are experiencing an increase of personnel mobility, which might constitute challenges for our administration. Third is the tight balance of medical supplies. At different levels, we have received support from inside the province and outside the province. But we are still running tight balance in terms of goggles, protective suits, and medical masks. And we are still facing with the gap to realize a sustained supply. We are also facing the pressure in terms of supply and price of daily necessities. Coming up, we will continue to act according to General Secretary Xi Jinping's remarks as well as instructions and implement the instructions of the provincial government and the party commission to reduce morbidity rate, fatality rate, increase admission rate, as well as recovery rate, and will prioritize treatment and quarantine as two of our most important links, and strengthen screening and identification, as well as administration of public spaces. We will do our utmost to win and to fight and win this battle against COVID-19. Now, Mr. Lu will talk about the situation of Jiangsu's medical team. Good afternoon. I'm the team leader of Jiangsu medical team and systems of Huang Shi's effort to fight against COVID-19. I will brief you on some of the work we've done and our plans for the future. First of all, the report of our situation of our team. On the February the 9th, we have received the order to come and assistance, and our governor have made instructions, and on the 10th, we have formed a team that consists of 100 doctors, 200 nurses, and 10 CDC officials. So this is actually our second team. We already have 6 members that are working in the Huangshi city prior to this. So altogether, we have 316 people working in the city of Huangshi, and they are really the most important warriors in this battle. We have a husband that is back in Jiangsu and wrote a letter to his wife who's working in Huangshi, praising her efforts and courage to join this team to come to assistance in the Huangshi city and expressed his expectations to her safely return. So the city of Hubei is our main battlefield. That's why we have formed this team in such short notice. And we have arrived in the city of Huangshi, in the Dayan city and Huangxin County, and we are welcomed warmly by the local government. Second, some of our work that we have done. First, to strengthen organization. We integrate with the local prevention control system and formed a temporary party commission and conduct investigation at the designated hospital as well as training of all the medical staff. We have also formed a panel of experts and recommend 32 experts to the city government to be allocated to 8 key hospitals to work as head of department and head nurses. Our medical teams also have sent 192 hospitals, and 62 in Daye, 62 in Yangxing. We also have conducted the scientific decision and treatment, especially to the critical cases. We have made an individual treatment plan for these patients in order to improve and increase the recovery rate and reduce fatality rate. For light syndrome patients, we also have conducted this expert rounds mechanisms to give them special care and pay special attention to the possibility for the light syndrome patients to turn into severe cases in order to improve recovery rate. For the close contacts, before they are discharged from quarantine, they have to be tested again in order to reduce the possibility of infection. At the Central Hospital and Infectious Hospital of Huangshi, we have conducted the renovation of ward zone, increase ICU beds, and improve the protection. The suspected cases, confirmed cases, and close contact and fever patients are treated in the collective manner respectively, and admit all of those that should be admitted, and treat all of those that should be treated, and check all of those that should be checked. Currently, we have participated in 61 emergency rescues and 123 patients and 403 light syndrome cases, and have tested more than 1,500 cases, testing samples. And next, we have strengthened our efforts in terms of ensuring medical supplies, including N95 masks, the medical masks, goggles, and protective suits. Altogether, there are more than 10,000 pieces. The relevant hospital also provide us with the much needed medical resources. We also carry with us emergency facilities such as ECMO, ventilators, and other important medical facilities. During our integration with the local team, we have allocated 50,000 medical suits and 10,000 medical protective suits. We have also received donations from the social groups, including ECMO, ventilators, 15 ventilators, and other medical supplies worth of 150,000. And we have also donated 10 million yuan to the local medical forces. And we are pulling all of our endeavors to help Huangshu to win this battle. Next is our working plan. We will act upon General Secretary Xi Jinping's instruction. The guidelines of the Central Leading Group, as well as the National NHC. We will increase our workforce if needed. In terms of innovation, we will provide the hospitals with long-distance consult and free medical clinics online. We will also ensure medical supplies, and we will be working with the local government to prioritize the patient safety and the residents' health. We've been working hard, but we are not afraid of the dangers and risks ahead of us. We will continue to improve recovery rate, reduce infection rate, and mortality rate. Now the floor is open to questions. Please make sure to identify yourself first. With Legal Daily, the provincial government have issued a document pointing out that treatment and isolation are two key points in the prevention control, so it is important to specify and implement these measures. So can you be more specific as to the measures taken by the city of Huangshu? The provincial government and party commission have issued important documents identifying two tasks, that is treatment and isolation. Currently, our key point in prevention control is to implement these measures, to upgrade all of the measures available. To be more specific in terms of prevention, we should prevent the spreading of the cases and prevent the import of the cases. In the 33 exit of the city, we have set up checkpoints 24/7 to check body temperature, to do registration of the outside the people coming from outside, to make sure that there's no imported cases. And the prevention of inner transmission, city transmission. First is the wide coverage of screening for all of the local residents. We conducted these checkpoints for body temperature and rewarded reporting, as well as household checkups. And we do this in order to make sure that no one, no day, and no household is left unchecked. and that we can have a full picture of the body temperatures of all the residents in our city. We have to discover the fever patients in time and send them for medical observation in designated medical facilities. For close contacts, we also need to improve the epidemiology and its depth, the time of such investigation, and discover possible patients or suspected cases as soon as possible to realize early detection and isolation. At the communities, living communities and villages, we conduct this kind of temporary close down of the living quarters. In key areas, in communities and villages, we use these hard barriers or roadblocks, or even through with this kind of passes. We issue passes to the residents to make sure that no outside vehicles or people comes in to the community randomly, to reduce the mobility of personnel and vehicles as much as possible. And third is the wide coverage in public places. Besides the most necessary living public, the public places, we close down all the other public places. For the places that provide daily necessity, and we have issue them license to maintain their operation, but we have closed down all the other public places. And in the operating places, we conduct daily ventilation and sterilization. We also have organized check the investigation teams to carry out survey on the street that is formed of community workers and police officers. In terms of treatment, we have accumulated experiences and have learned some lessons. Coming up, we will also continue to act upon the instructions of the provincial government and combine that with some of our experiences. So first, we have to have enough backups resources in terms of beds, wards. We should have enough backup beds that is twice of the confirmed cases, and so that we can make sure there are no patient that is left unadmitted. Second is to conduct categorized treatment at the city level. The critical and severe cases are receiving treatment in central hospitals, and the rest designated hospitals are treating light syndrome patients so that we can use the best possible medical resources to treat the most severe cases in patients. Third is to coordinate the medical supplies at the provincial level. So three, collectiveness, the collective of the patients, collectiveness of resources, and the collectiveness of medical staff. Some of the patients have the chronic diseases of their own. That's why we also have to continue to deploy the best medical resources to treat them and make individual treatment plans in order to reduce fatality rate and improve recovery rate. Fourth aspect is to strengthen the procurement and the supply of medical materials, including ECMO and negative pressure ambulances. In designated hospitals, we also have conducted this 3 zones, 2 channels construction, and we have to do renovation in this regard. And the renovation of ICU wards. In the past, we only have 21 ICUs, and right now it's 55. And we are continuing with the renovation process. Fifth, we will provide the medical workers with the best possible environment available. The frontline workers has been working tirelessly for many days. In terms of accommodation, their commute, and their families, there are a lot of difficulties, to be frankly. Currently, we are trying our best to address the problems that they have. We arrange them to stay at nearby hotels. We also help them with some of the problems at home. For some of the outstanding medical workers, they will receive timely rewards and incentives. We forbid the local cadres from using N95 masks and goggles so that these much-needed resources can go to the place where they are needed the most. This is to ensure that they can work in the safest possible environment. After arrival of Jiangsu medical team, our confidence have been boosted by a large margin. We will also be matching their efforts and provide them with better environment and resources and address the problems that they have. With Xinhua News Agency, we've taken notice that the recovery rate of Huangshi City is 20% and the death rate is 1.5%. So what have you done to improve recovery rate and reduce fatality rate? Mr. Ai Ming. Thank you for the question. Based on our reality, we have done work in the following aspects. First is to conduct categorized treatment and to conduct this unified coordination of the medical supplies. For the confirmed cases, we have set up the hospital to treat light syndromes, to treat severe syndromes, as well as critical syndromes. And altogether, more than 3,200 medical personnel have participated in these efforts. We have also unified our standard. Our panel of experts are conducting this consultation at different hospitals And for the light syndrome patients, for the light syndromes hospitals, the medical experts have done round checks and have given special attention to light syndrome patients that is old-aged and treat them according to the standard of the severe cases in order to prevent them from turning into critical or severe cases. And we also monitor them closely to guard against the possibility of turning into severe or critical conditions. Second, for the designated hospitals, we have conducted daily checkups for the city-level panelists of experts, panel experts. We have monitored the changes in our CT, and guard against the possibility of light syndrome cases turning into critical cases. For the hospitals treating severe and critical cases, we provide them with best possible medical resources and human resources and other clinical experts in order to make individualized treatment and management of these cases. This is an integrated treatment plan of their chronic disease and NCP. For fever patient and suspected cases, we strive to do the nucleic acid test on the same day in order to expedite the treatment process. Fifth, we also used integrated medicine treatment combining TCM and Western medicine. And we also have monitored closely their psychological condition. With Jiangsu TV, Jiangsu is abundant in its medical resources as well as human resources. So what technological advantages do the Jiangsu team have, and what kind of measures have you taken after arriving at the city of Huangshi? Thank you for your question. We have more than 310 medical workers who left their hometown with expectations to arrive at the city of Huangshi, but that only marks the beginning of our work. The leaders of the city are also experts in this. They have done some very good work before. We also have our advantages in terms of technologies, our techniques, our teamwork, as well as logistics guarantee. First of all, in our team, we have very professional doctors. For example, Dr. Huang Yingzi from Zhongnan Hospital. This is a CCM expert who have been participating in many important cases. And there's a alumni that is Mr. that is Dr. Qiu Haibo, who also joined this team. We have another expert, Dr. Feng. In 2003, this doctor was among those who come to assistance of the Jiangsu of Inner Mongolia back then during the SARS epidemic. We also have a very good team spirit. All the best hospitals in Jiangsu have sent their best staff. We have number 1 affiliated hospital and number 2 affiliated hospital to Nanjing University, and affiliated hospital to Suzhou University, affiliated hospital of Nantong University, Yangzhou University, and Xuzhou University. We also have expert at city levels that brings with them ECMO technology, ventilating technology, and nutrition support techniques. So such a team working under very good operation mechanism and working closely with the local expert have conducted our efforts in multiple fronts. Currently, our experts have also become head nurses and head of department in many designated hospitals in the Huangshi city. Every night, there is a meeting between the heads of department to make sure the coordinated work and standardized treatment. We also have very strong backup resources from our province. All of the hospitals are our strongest backups at providing us with the online consult and other technical support. So the whole society showed the biggest concern and interest in this effort. On top of what we have done, we will continue to optimize our landscapes of work. The ICU of Central Hospital has been expanded to twice the size as before. We also have streamlined the process to prevent in-hospital infection. For the hospital treating light syndrome patients, we also have done consultation to conduct early intervention with the instruction of the 5 INSISTs, as well as our coordinated work with the local experts. We will play a better role in this effort. Besides, we also have to take into consideration the emotions and empathy of our team members. Many of the team members used to be working or living in the province of Wuhan or city of Huangshi. I myself is a class 1983 graduate of Wuhan University, and we have a lot of teams who are joining me in this team. So there is very strong sense of brotherhood here and camaraderie between us. So we will do our utmost to join our local colleagues to spare no efforts to help you to win this battle.
人民日报记者提问：当前黄石各社区都实行封闭管理，势必会给群众生活带来不便。
With Renmin Daily, right now all the living quarters have been closed down. That might be bringing inconvenience to the local residents. How do you ensure the daily necessities supplies of the local residents? The closing down of the communities is essential to cut down the transmission of the infectious diseases. It is also proven to be useful, judging from the current situation of the epidemic. But inevitably, it brings a lot of inconvenience and difficulties to the residents' daily life. But our residents have shown the greatest understanding to the work that we've done, and they support our work and have encountered many challenges. Some of them even fight alongside us to show that this really is a people's war, and this is really moving. On the one hand, we have to upgrade the control measures, but on the other hand, we will do our best to also upgrade the measures to ensure the well-being of the people. First is to establish platforms to answer to the calls of the local residents through multiple platforms, like, for example, the hotline, the mayor's hotline, and the WeChat official account. We also would urge the government bodies and organs to answer to the needs of the people and make sure that all of the concerns are attended to and all of the questions are answered. We also have formed a volunteers team to help with the purchase of daily necessities to our citizens, or even help them with the maintenance at home. We also have issued many policies to ease the difficulties for our citizens, for our residents to go out. Despite the upgrading of control measures, we have different priorities at different stages. First is to conduct this kind of on the roadside vegetable vendors, so as to reduce the possibility of cross-infection in supermarkets. We also conduct this kind of unified purchase, unified delivery at the community level in order to address the difficulties of short supply in daily necessities. Third, we also encourage volunteer work to carry out more assistance. For example, for those welfare, for those under the welfare services, right now we see some rise in the prices of daily necessities in order to ensure that these vulnerable groups can have enough daily necessities. We also provide them with some donated free groceries. But in the end, we have to address all of these problems by winning this battle against the disease. But this calls for better cooperation on the side of our residents to reduce gatherings, to reduce trips, and stay at home. With China Daily, currently, altogether 192 patients have been discharged. So did you do any follow-up of the discharged patients? when the patient is discharged, he has to show 2 negatives, and his syndrome must disappear for 3 days in a row. But there are concerns among the discharged patients for fear of the possibility of reinfection. So we've taken the following measures. First, for discharged patient, we advise them to stay at home for 14-day quarantine. And if no further changes, they can be discharged of the quarantine. We also have conducted timely follow-ups by the social and community workers through telephones or by personal visits. Third is to strengthen psychological consultation. At the hospital, we have established WeChat groups or QQ chat groups with our patients so that they can contact our medical workers even when they have been discharged to conduct medical or psychological consultation. After 20 days of practices, in terms of the treatment of critical and severe cases, more than 10% of the severe and critical patients have been discharged. So I suggest that our patients should establish their competence and work and cooperate with our medical workers, especially our members from the Jiangsu medical team. They are a great boost of confidence and improvement of our medical capacities. We are very confident to finally win this battle. Last question. With Hong Kong Business newspaper, my question goes to Mayor Wu. As an industrial city, there are still many manufacturers that are in production. So how do you guarantee limited the least infection happening in workplaces? We have to do these 2 things together to guarantee the industrial production while preventing the disease from further transmission. Right now, we have 66 factories and more than 20,000 workers still working on the front line. And there are some enterprises that cannot stop that big. For example, the power generation. And second is the electronic manufacturers. And third type is pharmaceutical manufacturers. And fourth is power station as well as water services. Currently, the production of these manufacturers and enterprises remain stable. But we have to do work in the following aspect. First, to strengthen training to ensure that all of the staff have mastered the necessary skills of prevention. And second is to conduct flexible working hours and dining times and reduce unnecessary meetings and to increase the intervals between people. Second, to strengthen screening. For the outsiders, close contact we have to conduct strict screening, and we have established this roster of the staff to monitor their whereabouts and their health conditions to discover possible infections. Third is to strengthen prevention, to do our best to prevent the virus from spreading in workplace. Very strict monitoring of vehicles and these checkups at the entrance. To reduce infection due to long-distance commute. In the dormitories, meeting rooms, the bathrooms, and the workshops, we have to do very careful sterilization. And fourth is working protection. Make sure that they have masks and, if necessary, protective suits. And next is to arrange nearby accommodation. We will guide the enterprises to do production and prevention control at the same time. Currently, we are facing a lot of pressure, but our workers have been very self-aware, self-conscious, and they have established strong awareness. Currently, there are 7 confirmed cases, but none of the cases are infected in workplaces. There is no spreading of the disease at workplace so far. For some enterprises, there is this kind of semi-military administration, and it's utmost important for us to consolidate the work that we have achieved. Thank you again.